After my post-graduation, I was doing a job in Villupuram, and one of my phaco cases ended up with endothelial decompensation. I still remember that Babaji. When he used to come in my OPD, I used to feel really sad. And the sight of that particular edematous cornea was, it used to bring a lot of guilt. And I was really disturbed for good few weeks. I used to imagine, I used to dream that somehow can I go inside his AC and change somehow this endothelium. So that thought was going on for continuously many weeks. During the same time, my wife, who was doing her fellowship in Shankar Nitralaya, Chennai, she told me and called me up and said that, see, there is a conference coming up on this weekend and you can come to Chennai. So that was a good reason, and you can easily take a leave. I thought that I'll go, and I entered that conference room very casually. We were sitting in the back row, last row, and I was just chit-chatting with my friends, and suddenly there was something which caught my attention. There was this doctor called Dr. Mark Terry, who was showing a surgery which he termed as DLEK, and he was actually going inside the AC and changing the endothelium with his instruments. I was stunned. I was totally frozen. I still remember where the AC vent was there, and there was Dr. Pema, Dr. G.N. Rao, Dr. Fogla, Dr. Terry, where all they were standing. That particular picture is still very clear in my mind. So at that time, I think a decision was taken, and I was sure that I wanted to take up cornea, and that's how I ended up in Ali Prasad Institute and did my cornea fellowship. So you may call it a love marriage. So 1 year out of my fellowship, I was in practice, and I wanted to do endothelial keratoplasty. So I somehow managed to learn it, and when I posted my first case, doing that dissection and then doing that surgery, it was DSEK phaco combined in a patient of Fuchs, and then I could do it successfully in first attempt, and actually I could go inside the AC and change the endothelium. And then when I did, I was going home. I still remember I was driving, and I was talking to Dr. Bala, who was my consultant in LVPI, and I was telling him, Dr. Bala, I have done DSEK, and the feeling was same, which was equal to holding my elder son in my hands, and who was born just a few months back. And that Babaji is still 6'9", around more than a decade after the surgery. Then came this mucous membrane grafting. During our fellowship days in SGS patient, all we used to give was just lubricants. But in mucous membrane grafting, you can actually take this membrane from the lips and drape the inner side of the lids, and the sick cornea starts shining. The patient can open the eyes. We did this surgery in a 1.5-year-old baby, and whom we knew otherwise would, the eye would go blind. 4 years later, the child is smiling, going to school. It's just really amazing. Keratoprosthesis. It's wonderful to fix that PMMA cylinder into the cornea and then suture into the patient's eye. From hand motions, next day patient become 20/40. Slit. If you see when you do the stem cell transplant and see those beautiful cells growing on the surface, and then eye which is totally closed and really bad, and then suddenly starts seeing DMEK, my favorite surgery. All you have to do is just remove the Descemet membrane only and place it into the patient's eye. Doing that surgery again it gives a lot of kick. And it's not just surgeries, managing infections, dry eye, DLKs, keratoconus management, so many things, and doing all those surgery gives me a lot of kick. And seeing that smile, that billion-dollar smile from the patient's eyes, on the patient's face, I think that gives me even a very good high. So I think managing these cases, challenging cases day to day, and seeing them satisfied, that is the main spark, and thankfully I get it every day of my practice. Very difficult question to ask, but I'll try to answer. When I came into practice, I learned only penetrating keratoplasty, nothing else, because not many thing else was there at that time. After 1 year into my practice, I went to Singapore, and there I saw Dr. Donaldson videos of DSEC. And that time, and endothelial keratoplasty was the reason I came into cornea. At that time, I decided that I'm going to do it. I came back, called up Ramayana International Eye Bank and told Srinivas to send me a few rejected issues. Arranged a wet lab on my own, learned the level of dissection and posted my first case. And it went off beautiful. Until date, we have done, thousands of DSECs now. After 2 years, another 2 years, I always wanted to do stem cell transplant. Dr. Sangwan on 6th floor faculty lounge at LVPI, he described me how he is doing a new surgery where you don't have to depend on stem cell lab. I came back and did that surgery, and we did the first slit even before the first publication was out. 1 year later, there was this, I came to know about a keratoprosthesis workshop at LVPI, and Dr. Francinelli was coming from Italy, Dr. Jim Chodosh was coming from Harvard. I decided that I'll go there for this 5 days and attend this workshop. One of my friend asked me that how can you take leave in private practice, that too for 5 days. I couldn't understand his question. I went there, learned that, came back and started doing keratoprosthesis. Then I came to know that for SGS patient we can do lid margin MMG. Again went to LVPI, spent some time with Dr. Sayan Basu, very good friend of mine, and learned that surgery, came back, started it. And then I think a couple of years later came my favorite surgery, DMAC. There, and how did I learn it? Dr. Rajesh Fogla, BOA, 2015. We sat on a coffee in a coffee shop, and for good 2 hours he explained me everything he knew about it. I watched a few more videos, started doing it. Had few hurdles, and then during one of the meetings in ESCRS in Barcelona, I learned a small way to do the surgery in a different way. And then and now at the moment we are not only doing all these surgeries which I learned in my practice, we are also teaching about it. So I think this hunger to learn and getting uncomfortable whenever there is something in your field and you are not doing it, that particular thing I think might have contributed to whatever we are doing at the moment. But I know a lot of areas where I still need to learn. When I declared that I want to do cornea in private practice, my friends, colleagues, seniors, they cautioned me. They told me about 3 challenges that I'm going to face. 1, the money in cornea would be less than in refractive and cataract surgery. Second, you'll have to take care of these patients lifelong. The prognosis will not be that great as you see in LASIK and cataract. Third, you'll have to go through medico-legal, administrative and all the hassles of being a transplant surgeon and transplant center. But I was quite adamant that I want to do cornea only, and they were also right. I had to go through all. I belong to a middle class family, not much financial support. From that to building up an ophthalmic center which has all the latest diagnostic and therapeutic modalities was full of challenges. So many challenges that I can't even explain. But my mentor used to say that you don't need money to practice. He used to say that you need desire. And I learned, or I understood this meaning of Dr. Sangwan 10 years later. Yes, sometimes you have to deal with graft infection, graft rejection, graft failure. Result sometimes is not what you or patient expects, and then you have to deal with your own thought process, and you have to counsel the patient as well. So I have gone through all of them. I have dealt with all the problems that can happen, be it medical, legal, administrative, all the hassles of being a transplant surgeon or transplant center. All the time during these challenges, my thought process had been that stay firm. Every day the wind is not going to be in your direction. Sometimes it's going to be in opposite direction. When it's opposite, sometimes you can't run with your full speed. You'll have to slow down. Maybe you have to walk, and sometimes just stand. Just standing when the wind is quite fast in opposite direction, that is also a win. So I think these are the life situations which you can call challenges. now with the knowledge that I can explore in so many fields, if I take up cornea, I'll definitely take up cornea again. And the initial one can be infatuation, but this time it will be a love marriage for sure. I heard somewhere the definition of easy and difficult. What is easy and what is difficult? Easy is if you want to achieve something very passionately, your desire is very strong, and there is at least one human being on this planet who has achieved before you, then it is easy. And if you want to achieve something which no human being has done ever, then only it's difficult. So I think just follow your heart, and there are very high chances that it will be easy. And if you choose a difficult or do a difficult thing, including me, each and every human being will come to know. All the best.